Leelambar,
Yes. Good afternoon, ma'am. Hello. Am I audible, ma'am?
uh, Leelambar,
Yes, ma'am.
when we start the national anthem and when Madhukari ma'am will join, then you have to start the recording, not
Okay,
now.
ma'am. Okay. I'm just
To attend this ANEI Empower Hour. And we know that just recently we had an ANEI Con 2026 at Mumbai Tajland on 29th and 30th of May. I am sure that many of you have attended. I met with Madam Shakuntala, who has attended the ANEI Con. So this ANEI Empowered Hour, there's ANEI Young Leaders Nurse Alliance, where we connect and we learn a different, the theme where many of the speakers, those who are taking a different topic, which enlighten us and given us a lot of knowledge. So this time, the ANEI Empower Hour conducting by the East Zone, and in the East Zone, the Bengal chapter has already done it. Now the turn has come for the Chhattisgarh, and I am great and to introduce Ms. Shakuntala Katam, who is the Chief Nursing Officer of ITSA Hospital, and she is having 22 years of long experience of handling the entire team. Shakuntala is the ANI member, and she is also the president of Chhattisgarh chapter, and she is having a lot of acumen to conduct various program, and we have seen that for the year 2025 to 2026 he has taken up many initiative to uplift the Chhattisgarh chapter. Many of you, I am sure, might have attended this program, and you have gone through and you have seen the way the chapter is growing. I am Dolly Bishwas, Chief Nursing Officer of Fortis Hospital, Anandpur, holding the National Secretary position of ANEI, that is Association of Nurse Executive of India. So I have already introduced Shakuntala, who is having today the position of moderator. And today we are going to have the ANEI Empower Hour AYNA from Chhattisgarh chapter. The theme of today's Empower Hour is perioperative nursing, leading safety across the surgical journey. Along with her, Miss Mini Varghese, who is the Vice President of Chhattisgarh chapter, is there. Joined, she is the Nursing Superintendent of Ramakrishna Care Hospital, Raipur, Chhattisgarh. Today's our eminent speakers are Miss Tripti Rani Nayak, Mr. Vaibhav Dikshit, and Miss Alicia Singh. They will be enlightening us with a various topic based on the theme. Before starting, I would request, before starting today's the Empower Hour session, I would request our nursing educator, Mr. Lilambar, to play the ANEI anthem, and let us get energized, let us get focused after listening to the ANEI anthem the entire session. So thank you very much, and over to Lilambar for the ANEI anthem.
thank you, ma'am.
Thank you.
Just just a second, ma'am. I'm sharing my screen. Then I'll play it.
We are the voice, the hands that care, guardians of hope, always there. With wisdom and courage, we stand tall, answering the call, serving all. In every moment, through joy and strife, we lead with purpose, we honor life, building the future with knowledge and grace, transforming healthcare in every space. Passion to action, our guiding light. For every life, we fight the fight, upholding safety with hearts so true. We are ANEI, proud in all we do. Together we rise, united we lead, planting the seeds for a brighter tomorrow. Together we rise, united we lead, planting the seeds for a brighter tomorrow. ANEI, nurses make the difference to humanity, shaping the future with strength and unity. Passion to action, our guiding light. For every life, we fight the fight, upholding safety with hearts so true. We are ANEI, proud in all we do. We are ANEI, proud in all we do.
Ma'am, you are mute. Ma'am, we are not able to
Thank
hear
you.
you.
Thank you very much. And I'm sure after hearing this, anthem, everybody understood that every words means a lot. The anthem is, you have read, it has been written by Mr. Bipin Peter Charan and lyrics given by our very own Tankam Gomez madam. So many, a few like-minded people, those who have actually the founder member of ANEI, they are, one of them is our very own Captain Ajita Nair, who is the president, and with her the people like Ms. Durga, who is holding the vice president position, and our treasurer Miss Harita. I am sure they also will be joining the program, and all these people, those who are always motivating to do something differently. Not only them, but many seniors, even our many seniors people, those who are as a nursing leader very known in our country, they are always encouraging the youngsters to come up and take the membership of ANEI. So without, I am sure that in future every people will think or will take the membership of ANEI and join and make this ANEI a big or a bigger group. At this moment, we have 1,800 members in this association, but in India, more than 25 millions of nurses are working. So I'm sure everybody will join one after the other. So without spending any more time, over to Shakuntala, who is the moderator of today's Empower Hour. Shakuntala, over to you. Please take ahead the entire sessions. Thank you.
Yeah. Thank you, Dolly ma'am, for the warm introduction. Myself, I'm Shakuntala Kartam, Chief Nursing Officer of ITSA Hospital and also a President of Chhattisgarh chapter. It is my privilege to welcome all of you to the ANEI Empower Hour for the month of July. It is organized by Association of Nurse Executive of India, Chhattisgarh chapter. As a newly established chapter, the program marks an important milestone in our journey towards professional excellence and nursing leadership. Today's theme already, Dolly ma'am has told about the theme. So today's theme is perioperative nursing, leading safety across the surgical journey. So the highlights the role of critical nurse plays an important role whenever the patient is getting admitted for surgery. The care starts from before surgery, during surgery, and after the surgery. And International Patient Safety Goal 4 remind us to ensure the correct site, correct procedure, and correct surgery. So before we proceed further, I would like all of us to reflect on the one important thought. When patient enters the operation theater, they place their complete trust in the entire healthcare team. At that moment, that perioperative nurse become the patient voice, patient protector, and also the patient advocate. Like every assessment, every checklist, and every instrument count, and every communication we do along the team, we perform and contributes directly to the patient's safety. So success of the surgery is not measured only by the surgeon's skill, but also the entire teamwork of perioperative team. So we have the fortunate to have experienced speaker who will share their valuable insight and practical experience. So let us begin our learning journey. So the first session, it gives me immense pleasure to introduce our first speaker, Mr. Vaibhav Dikshit. He is OT manager in ITSA Hospital, Raipur. And Mr. Vaibhav Dikshit bring rich experience in operation theater management and perioperative service. So today he'll be speaking on the foundation of safe surgery, essential of perioperative care. So please join me in welcoming Mr. Vaibhav Dikshit. Over to you, Mr. Vaibhav. Brother Leelambar, can you please share the screen?
Yeah, ma'am, I'm sharing, ma'am. So my screen is visible, ma'am?
Yeah, we are just checking.
Yeah.
Yes.
You just
Can you put in full screen?
open it.
Yes, ma'am.
The slide, yeah, you have to
Yes,
open this.
it is visible.
Open the slide.
Vaibhav, can we start the session? Over to you, Mr. Vaibhav.
Yeah, ma'am. A very good morning to everyone. Respected Dolly ma'am.
Thank you.
It is my privilege and honor to stand before you today I am Vaibhav Dikshit, working in ITSA Hospital as OT manager. Before I begin, I would like to express my heartfelt gratitude to Shakuntala ma'am, who is the president of Chhattisgarh chapter, and without her constant guidance and for giving me not this valuable opportunity to present on the STEAM platform, her encouragement and trust made me this moment possible, and I am truly thankful. uh, Patient safety is not merely a priority, it is the foundation upon which quality healthcare is built. Every year, millions of surgical procedures are performed worldwide. And while surgery has the power to save lives and restore health, it also carries a risk that can minimize through meticulous perioperative care, from perioperative assessment and preparation to intraoperative vigilance and postoperative recovery. Each step plays a vital role in ensuring patient safety and achieving successful outcome. Pre-operative care is more than a sequence of tasks. It is coordinated, evidence-based approach that empathize patient-centered care, effective communication, infection prevention, and adherence to safety teamwork. These essential elements from the cornerstone of safe surgical practice and contribute significantly to reduce complication and improve recovery. Probably through this presentation, I hope to highlight the critical components of preoperative care and reinforce the importance of fostering a culture of safety in surgical practice.
Vaibhav, 1 minute. I would
Yeah.
request
ma'am.
everybody to mute their mic. Mute.
Sabha ma'am, can you please
Mute
mute the
yourself.
mic? Yeah, please continue, Vaibhav. Dolly madam, you have to unmute, ma'am.
Please unmute Vaibhav and continue.
One second, ma'am. I'm sharing the actually screen. Ma'am, my screen has already taken from Lilambar, I guess.
So should I change the screen slide?
Yeah, please actually
Yeah.
let me handle from my side.
Okay, so I'm stopping the screen sharing. Okay.
Yeah, please.
Okay, just a minute, brother.
Hmm.
Now you can share your screen, brother.
One second. So, today is topic of foundation of safe surgery, essentials of preoperative care. Uh, so today we are learning objects preoperative nursing care and phases of preoperative care, patient safety measure, and the role of nursing in safe surgery, along with WH surgical safety checklist. Introduction of preoperative care. Preoperative care encompasses the care of surgical patients before, during, and after surgery. We can divide in three parts, and the goals are ensure patient safety, prevent complication, promote optimal surgical outcome, and enhance the patient experience. Importance of safe surgery, which is WHO statistics has millions of surgeries are performed worldwide annually. Surgical complications are among the leading causes of patient harms, and many adverse events are preventable. Safe surgery saves the lives. We can reduce the mortality rate, reduce the post op the surgical complications, and improve teamwork and communications. So there are three phases divided in the part of surgical is perioperative, intraoperative, and postoperative. So before surgery, we can patient assessment and health evaluation. preoperative education and counseling, risk identification and optimize and preparation of the patient and informed consent. So preoperative patient actually comes from the ward or somewhere else. So we can assess the patient, how the patient is, and preoperative education, what's supposed to be done with the patient, and risk identification, what are the risks can be minimized and how can we reduce the risk is. So intraoperative during the surgery, what we are doing, ensure patient safety, maintain aseptic technique, and monitor vital sign and patient status and effective communication. And postoperative, same, monitor recovery and vital patient management and medication administration, prevent complication and infection, and provide emotional support and discharge planning. So pre-operative nursing responsibilities for the nursing, patient assessment, what is the patient having medical history, what is the patient having like medicine allergy or body reaction or current medication what he is having, like if the patient having any blood sugar like cardiac comorbidities and hypertensive is he taking, or previous surgery, what surgery he has already done. And verification, patient identification, we used to identify with the ID band and patient UMR number. What verification we used to done with the consent, what surgery is going to be done, and surgical site marking. Surgical site marking is especially when the patient is going to be operated. That has to be done by the surgeon and uh, reconfirmed by the staff nurse, whoever the nurse is there. And what used to prepare, what is the need for preparation, what are the requirements, was his fasting status, what does the patient have, sugar in fasting, skin preparation, what is skin preparation kind of, we are using chlorhexidine, or we are using like iodine, or preparation for the, what are the need to removal the jewelries, dentures before the surgery, because that can cause a risk factor. So we have the pre-operative checklist kind of patient identification. We can identify it with the patient with the like uh, uh, patient UMR number, patient NBM should be there 6 to 8 hours. CSG bath, we are using chlorhexidine 4% for the bath. Correct patient, correct procedure, correct site, we have the IPGL goal 4. Consent signed by the doctor what surgery is going to be done, and investigation review that has to be done by the anesthetist. PAC, pre-anesthesia checkup, or before the taking the patient in the OT, investigation review should be done by the anesthetist. Blood ability, confirm what the surgery is going to be performed and how many blood can be stored for the surgery. If the blood loss is more, so we need to keep the blood arranged. And pre-operative prophylaxis, antibiotics before the incision, there is a duration 1 hour. So 1 hour before the incident, that antibiotic should be given. Part preparation according to the surgery, what surgery is going to be performed, according to surgeon and according to patient, what kind of preparation he wants. Change the OT gown, cap, mask. Change the OT gown before we taking the patient in the OT. We need to change the OT gown, cap, mask, so that can reduce the risk of surgical site infection. Jewelry to be removed that can cause a burn over there, so jewelry, implant and prosthesis should be removed. Allergy identifies, if some patients having the antibiotic allergies, so need to identify skin is very important.
Vaibhav, can you please do the full screen?
Yeah, 1 second. Is it okay, ma'am?
Yeah, okay.
Intraoperative nursing care. So, what is the role of the nurses? Scrub nose has the role maintain style field, instrument handling. Maintain style field, how we can maintain style field, how we can use the aseptic technique And instrument handling, we should use the aseptic technique also, and see how the instruments are like autoclaved, ETO'd. That has to be checked by the nurse. Circulating nurse has a different part coordinating activities before the taking patient in the OT. They have the surgical checklist before induction of the patient. This has to be done by the circulating nurse. And so patient safety is not should be compromised. OT team collaboration, surgeon leads to the surgical procedure, anesthetists manage the anesthesia and patient stability, nurses provide intraoperative care and support, technicians assist to equipment and technology, what instrument and what the equipment is needed, that handles the technicians. So principle of aseptic technique, sterile practice, surgical hand wash. The surgical surgeries usually 3 to 5 minutes has to be done. Hand washing, sterile donning, and how to know donning should be known to the staff. Sterile instruments handling, how to like handle the sterile instruments. Sterile field maintenance. So these are the like style practices. That outcomes comes to prevention of the surgical site infection. Aseptic techniques protects patients, promotes healing and save lives. Nursing intervention is proper hygiene, head hygiene, appropriate antibiotic training, skin antisepsis, and sterility maintains environmental cleanliness. That are the principles of aseptic techniques. So WHO surgical safety checklist in the divided into 3 forms. Sign in, that is actually before induction of the patient. Before induction of the patient, that has to be done by the circulating staff and the anesthetist. Confirm patient identity, that we confirm with the UMR number and patient name and ID band. Confirm consent, what surgery is going to be done and what are the consent he has taken. And confirm site marking, that has to be done by the consultant or doctor who is going to operate. Check anesthesia machine and medication. Before induction, we have to pass the machine and check the machine while it's working or not, and there is pulse oximeter functioning on the patient, that is also check. Confirm allergies status, that we have already checked in the pre-op. Assess difficulty, airway aspiration risk, we have to check the patient difficulty airway. If the patient having like a short neck or something like difficulty airway, we need to prepare accordingly equipments. So time out before the taking incision, that has to be done by the circulating staff, whole the team one by one. As team introduce name by them role, like surgeon used to tell this name and what is the role his name. As the scrub nurse also does the same thing, anesthetist also same thing. So we need confirm patient name, confirm procedure, confirm site marking site, and the antibiotic has given or not, and confirm is essential image displayed, because if the ortho cases has in the OT, so need the images required. Discuss anticipated critical video, what the critical events can be happen. So we need to prepare for that also. Sign out before closing the before leaving the OT. Confirm procedure, sometimes the procedure are like converted in something else. So procedure, what is the what procedure confirm, and confirm instrument before closing the rectus sheath or the cavity. So sponge, instruments, needle counts has to be correct. Confirm specimen level including the patient. Once the specimen comes out, you need to take in the specimen container, which is seal pack, and then and there you need to read the patient, put the sticker, patient name, and label the what specimen is. Confirm any equipment problems to be addressed. If the anything equipment issued during the surgery, that has to be checked and addressed to the respective area. Confirm post-operative plan and recovery management communicated, that already communicated with the anesthetist. They used to tell what's supposed to do, like should be keep in the ICU or recovery room. That is the WHO surgical safety checklist. Instrument is sponge and needle count status before procedure initiate. When we take the patient in the OT, there is a set, we open, there is a number, how many instruments are there and how many we are taking in the from the instrument boxes. So before procedure initiate count, before the procedure begins, we used to wrote in the blackboard. And second is before cavity closure. Once your cavity about to close, just count the instrument and the needles and mop, gauze piece, everything. Before skin incision, count performed before closing the skin. At procedure complication, final count of the skin closure, how many needles we have used and how many you have. So what is the goal of this? Prevent retain surgical items. Accurate count help prevent retain instrumental sponges and needle, ensuring patient safety and reducing complication. What we count? Count we instruments counts, sponge counts, needle count, and very specifically gauze, radioactive gauze also. So what practices, best practices, use a schematic count method, count aloud and confirm together. Once circulating nurse and surgeons should know how many counts we have. So document count accurately, report the dispensary immediately, never leave OR with the unresolved. If the like counts is not correct, please don't like don't leave the OR. Just count and correct, then only you can leave. Patient position and safety. So safe position, safe patient, successful surgery. What is the actually nursing responsibility? Pressure injury prevention. First of all, actually, prolonged surgery causes complications like we can say the pressure injury and nerve injury and muscle spasm that used to happen with the prolonged surgery. So pressure injury, what we can do for the prevention: assess pressure points before position, use gel pad, form support, and position devices. Reposition as a appropriate during prolonged processes. Nerve injury prevention we can do is avoid excessive stretching, compression, or hyperextension. We can minimize this thing. Maintain proper alignment of the limb and joints. Protect vulnerable nerves like ulnar, mostly brachial and ulnar used to damage. Secure patient, ensure patient's stability throughout surgery. Apply safety strap appropriately. Prevent movement from anesthesia and surgical process. There is some surgeries of colon where we use Trendenberg, so we used to keep the straps and support for that, so patient will be not harmed. And padding vulnerable areas like head and occipital. Once the patient goes for prolonged surgery, that actually hurts. So elbow and shoulders, sacrum and coccyx, heels and knees. Example of safe position: there is a supine position, head support is given, and for the hand like arm, there is a arm board and padding on knees also. So lateral position, there is a strap over there and putting a pad in the between the legs and ulcer points, where the ulcer points are there. Axially protective for the plexus, and lithotomy positions are there. Arms secured with the padded and padding also sacrum, legs in the strap with the padding, and the patient goes under prone position. Some of the basically that is like if the spine surgery is going to happen or like brain tumor is going to be happen, the prone position is more good for that. Head is neutral position, so patient like is no rigid after the surgery also. Padding under the chest and pelvis, so patient will feel good, and padding to the knees and toes, so nothing will happen. What is the potential risk is what the risk? The pressure ulcer caused by the prolonged process of bony proneness and nerve damage may result in a temporary or permanent sensory motor deficit, and falls can occur during the transfer for improper position. Correct position protect the patient from the preventable injuries and the ensure optimal surgical access, safety, and comfort. So specimen management into OTA. Correct labeling. Label the specimen container immediately at the point of collection, including all required information clearly. Patient identification. Where verify patient identification using two identification: name or MRI number. Just like I have told you before, match with the specimen label and request form. Documentation is very important. Complete the specimen request form accurately. Include clinical details, date, time, and such information. Prompt transformation: place specimen in a leak-proof container, use appropriate transport bag, and send to the laboratory without delay. And fifth one, the handover and the recipient confirmation. Hand over the specimen to the authorized person, obtain receipt confirmation whether it's possible, and prevents diagnostic and treatment errors. Wrong diagnosis due to the incorrect and mismatched specimen, inappropriate treatment due to wrong results, delay to the diagnosis and treatment, legal and ethical consequences. Accurate specimen management ensure patient safety and quality care. Post-operative nursing care, what are the goals we have? It's a first is immediate assessment is the airway, breathing, circulation, pain, and close care. Airway ensure the Asian airway patency suction is required, and breathing assess respiratory rate, depth, and effort. Check oxygen saturation, check pulse, blood blood pressure, capillary refill, and skin color, temperature. What we used to see, and we used to do actually from the Eldred score. Monitor vital sign, bleeding, wound condition, and additional we can use maintain a safe and comfortable environment, administer prescribed medicine. So maybe after procedure, patient having pain, so administer prescribed medicine, encourage deep breathing so their chest will be good, maintain fluid balance, intake and output, provide emotional support and patient education so patient will not be worried about it. Common post-operative complication. What are the complications we have in the post-op? Complication is after surgery is a bleeding, SSI, DVT, respiratory issue, and pain. So bleeding, excessive bleeding at the surgical site, essentially what's supposed to do in the nursing action? Assess the amount of the type of blood. It is like is serous is there or the fresh bleed is there. Check vital sign frequently. There is changes in the vital signs is going down or up. Reports immediately to the surgeon if there is excessive bleeding. Prepare to the possible intervention. What we else can do after surgery to prevent bleeding. So there is SSI, surgical site infection, wound assessment, assess wound the sign of the infection. Is there is redness, see itching, or something like that. Monitor temperature of the WBC. What are the WBC counts are raised or not, and maintain aseptic technique to dressing changes. Once we add post-op, please use the aseptic technique. So that is preventable for the SSI. Report sign to the infection promptly if there is any sign. So DBT is early mobilization, encourage early mobilization to the order, perform leg exercise for the range of motion, use compression, stockiness or IPC devices, monitor for the sign of DVT. If there is DVT sign, please inform to the consultant so we can promote it from that. Deep breathing exercise, increasing deep breathing and coughing. Use incidentally spirometry as ordered by the surgeon. Turn cuff, deep breathe, TCBD, and regularly. Please monitor respiratory rate and oxygen saturation. If the patient having pain, what's supposed to do? Pain assessment and management. Assess pain using appropriate pain score. What are the pain score? And administer pain medication as prescribed. Evaluate effective of pain relief. Use non-pharmacological method, relaxation and position. What is the general nursing priorities? Ensure patient safety at all time, during, before, or after. Monitor and document observation. That is very important, and provide holistic care and emotional support. That is also very required for the post-operative care. Patient, educate patient and the family about recovery. Follow, report and escalate concern promptly. Communication and teamwork. As bar communication, as everyone has listened, as we are communicating, situation, background, assessment, and recommendation. What is the problem? State in issue briefly, and background. What is the background of context? Relevant history and event. Assessment. What I think to is happening, and your assessment is the situation. Recommendation. What do I recommend? Suggest action for the required needed. What's the surgical brief? Pre-operative teams discussion to the plan and prepare for the safe procedure. Key discussion point are the patient identification, procedure and site, patient history and allergies, anticipate critical events, review the equipments and implants, assign roles for the responsibilities, confirm antibiotic prophylaxis, and address any concern during the surgery. That has also be documented. So everyone is goal is everyone is informed, prepared, and on the same page. Surgical debriefing, post-operative team discussion to the evaluate and improving. Key discussion points are what went well, what were the challenges, and what critical events managed well. Equipment, instrument, issue any, what can do better next time, of any concern or the patient recovery. And what is the goal is continuous improvement in the better team performance and the patient recovery. Impact, what actually impact to the patient safety and reduce error. So enhance team coordinating with the role KT, reducing misunderstanding and omniscience, and promote a culture of safety and equality, improve patient outcome and satisfaction. The key principle of effective communication is speak clear to the listen activity, use closed loop communication, confirm and uh, uh, verification. That are the key principle. Role of preoperative nurse in the patient safety: safe patient quality before the outcomes. Advocate patient, protect patient rights, respect patient dignity, value and preference, ensure perform consent, speak up for the patient safety, and promote ethical and respect care. So educator, what's supposed to do in educate, what's supposed to you educate to the patient, explain procedure and what to expect, teach pre and post operative instruction, and reinforce self care and recovery measures, empower patients to participate in the care. Please share the knowledge to patients, make your choices, and coordinator. Ensure continuity to the care. Communication effectively with the healthcare team. Coordinate across to the perioperative continuum, and ensure accurate documentation and handoff. Anticipate need the prevent delay or error. So there is for prompt safety culture, set the standard for the safe practice, encourage open communication and teamwork, identify the risk, report risk, supply quality improvement initiative, and mentor and inspire the others. So there is a case study which actually I have mentioned in this routes, wrong site surgery prevented through proper checklist. So a scenario, a patient was scheduled for the left knee orthoscopy during the WHO safety checklist timeout process. The OT nurse noticed that the surgical consent from the indicated to left knee, but the surgical site marking was missing, and the operation team was preparing the right knee. The nurse immediately stopped the process of the initial verification with the surgeon anesthetic and patient records. Stop the consent, said the left knee, but the right knee is being prepared. Correct action is equal to safe outcome. Wrong side surgery was prevented. The patient received the correct surgery on the left knee. A discussion is like what action be the nurses prevented harm. Actually, the patient was planned for the left knee, but error was that nobody has gone through the surgical safety checklist, so they prepared the right knee. But at the same time, the staff taking stand to stop the consent to read left knee. What are the key nursing actions are verified nursing identification, confirm the correct patient using at least two identification like band name and UMR number, reviewed surgical consent, what consent has taken, that has to be checked in the pre-op ward and before taking the patient in the OT when the time of surgical safety checklist. Recognize dispensary notice. uh, Notice the inconsistency between the consent and surgical site preparation, and so safety site verification that has to be the surgeon and checked by the staff and pre-op and before taking the patient in the OT also. So there is three barriers to check what actually surgical site verification is done or not. Initiate team communication, engage the surgeon and status and OT team is re-verified. Follow WHO World Surgical Safety Checklist, ensure the timeout process was completely correctly, and prevent wrong site safety surgery adverted to the serious preventable surgical error. Key take aways is patient safety is everyone's responsibility. In the OT, each member, anyone can stop if something goes wrong. Every member of the surgical team contributes to safe outcome, adherence to the standard prevents harms, following protocol policies and checklist reduces errors. Effective communication improves outcome. Clear communication enhances teamwork or patient safety. WHO surgical safety checklist saves life. Standard verification prevents avoiding surgical errors. And preoperative nurses are the central to the safe surgery. Nurses able to advocate, educate, coordinate, and safety leaders throughout the surgical surgery. Thank you. Thank you so much.
Okay, thank you, Mr. Webber, for excellent and informative session. It was very good session, and we have learned from the real example of surgical error. So I would like to ask one simple question to everyone, that what is our primary responsibility in operating room? Can you quickly write into the chat box, please, in one word. What is our primary responsibility in operating room? The answer is patient safety. Whether it is verifying patient identity or confirming the surgical site, maintaining sterility, or monitoring the patient condition. Every action we take has one common goal: to ensure the prevent harm and ensure the best possible outcome for the safe surgery. Thank you, Mr. Weber, once again. So I will invite the next speaker. Our second session focus on overcoming challenges in perioperative nursing practice. It is my pleasure to introduce Ms. Alisha Singh, infection control nurse, who has extensive experience in infection prevention and patient safety. She will be speaking on breaking barriers, challenges, and solution in perioperative nursing care. Please join me in welcoming Ms. Alisha Singh. Over to you, Ms. Alisha.
Thank you so much, ma'am. Good afternoon, everyone. Firstly, I would like to thank you so much, Dolly ma'am, Shakuntala ma'am, and Mini ma'am, to giving me the great opportunity to share my knowledge and views upon this. And good afternoon to everyone all. First up, I'll introduce myself. My name is Alisha Singh, as an infection control nurse working in Ramakrishna Care Hospital, Raipur, Chhattisgarh. Today, I will be presenting on the breaking barrier challenges and solution on perioperative nursing care. I am pleased to have this opportunity to share some key information and insight with you. I hope you will find this presentation information and interesting. Ma'am, can you please share my slide? Screen, ma'am.
Lilamber, please share.
Can you move this slide? First, perioperative nursing, a term used to describe the entire duration of surgery, including what occurred before, during, after the actual operation. Perioperative nursing is a specialized nursing field that provides holistic patient-centered care throughout the entire surgical experience. So, brother already explained it very briefly, that the surgery will be consist of three phases: pre-operative, intraoperative, and post-operative. Can you move this slide? Pre-operative, just I generally explain. General pre-operative nursing intervention. First, provide pre-operative teaching like a deep breathing exercises, coughing exercises, mobility, and activity body movements, pain management. Then provide us psychosocial interventions, reduce anxiety and fever, and respecting culture, spiritual, and religious belief. Then maintaining patient safety, managing the nutrition and fluid, prepare the skin and bowel. Then moving around to intraoperative. So I will just explain as a scrub nurse challenges in OT. Maintaining the sterility, ensure the aseptic technique and prevent contamination of the sterile field. Managing the surgical instrument, knowing the instrument, anticipate the surgeon needs and maintain the organization and the high stress environment. Handling the emergency, complications and time sensitivity situation calmly. Long working hours, extending a standing and physical strain during the lengthy procedures, communication and teamwork, coordinate effectively with surgeons, anesthetists, and OT staff. Then patient safety responsibility, accurate count, infection prevention, adhere to the protocols, technology and continuous learning, adapt to a new equipment, technique, surgical technologies, emotional stress and workload, managing depending on a schedule and emotionally challenges cases. Then ethical consideration providing the perioperative nursing care. That I'm going to explain that adhere to the professional codes, follow the nursing codes of ethic and institutional policies, practice within the scope of professional competency, informed consent, verify that informed consent has been obtained before surgery, ensure the patient understand the procedure, risk, benefit, and alternative. Patient safety. Follow the surgical safety guidelines, which brother already explained in brief, including the patient identification, site marking, surgical safety checklist, report and prevent error, near misses and unsafe practices, confidentiality, maintain a privacy of patient record, health information, discuss patient information only with the authorized personnel. Advocacy. Act the patient advocate when they are unable to speak for themselves during anesthesia and surgery. Communicate patient concern to the surgical team. Interprofessional collaboration. Communicate effectively with surgeon, anesthetist, and other healthcare personals. Promote teamwork to ensure safe and ethical patient care. Compliances with the surgical safety standards. Follow the guidelines such as this WHO surgical safety checklist, hospital infection control protocols, ensure aseptic technique and maintain throughout the perioperative period. Respect for the patient right also. Respect culture, religious and personal belief. Support the patient right to refuse treatment. Intraoperative risk reduce measures. Perioperative oxygenation. Adult patient undergoing the general anesthesia with a tracheal intubation for the surgical procedure. 80% fraction of inspired oxygen intraoperatively in the immediate post-operative period for 2 to 6 hours to reduce the risk of SSI. Goal to increase the tissue oxygenation and perfusion with helps prevent SSI. Then maintaining a normothermia, used for the warming device in the operating room, maintaining a core body temperature above 36 degrees Celsius, preserve immune function, improve tissue oxygenation, enhance the effectiveness of antibiotic. Preoperative strategy, active pre-warming, use forced air warming blankets to warm the patients for 20 to 30 minutes prior to anesthesia. Patient education, importance of staying warm before surgery. Measure baseline temperature, patient temperature 1 to 2 hours before the start for anesthesia. Intraoperative strategies are forced air warming, warmed IV fluid, and irrigation solution. Intraoperatively, another risk are the adjusting the operating room temperature, passive warming, insulate non-surgical patient body by the thermal or reflective blankets. And post-op strategies are rewarm a hypothermic patient in the recovery room, continue regular monitoring of a temperature in the recovery room, and manage the shivering. And some changes of the surgical instrument. No difference in the SSI when the instrument are changed. Facial, subcutaneous, skin closure, or using a new set for the sterile instrument. No recommendation. Then laminar airflow. A ventilation system in a operating room, combination of a pre-filter and high efficiency particulate air or HEPA filters to minimize the airborne microbial contamination in operating room. Clean filter air is supply a unidirectional at high velocity. Particle-free sterile environment reduce airborne contaminated in operating room. Importance of engineering control. Reduce exposure to hazard. Control hazards such as a dust, fume, noise, chemical, heat, and radiation before they reach work. Provide continuous protection. Once installed, engineering controls work consistently without requiring constant worker action. More effective than PPE. PPE can fail if used incorrectly when engineering control remove or isolate the hazard itself. Prevent occupational disease and injury. Help reduce respiratory illness, hearing loss, burn, poisoning, and other work-related health problems. Improve productive and comfort. A safer and healthier work environment often leads to the better work performance and morale. Support legal compliances, help organization meet workplace safety, regularizations, and standards. These are the example of the engineering controls. Some viewpoint upon the post-operative nursing care, assessing the patient, maintaining a patient airway, maintaining the cardiovascular stability, relieving a pain and anxiety, assessing and managing the surgical site, assessing and managing the gastrointestinal function, assessing and managing the voluntary voiding, and encourage the activity. Thank you so much.
Thank you so much, Alicia, for the wonderful presentation. You have spoke about the engineering control, which is very, very important to know. Like every nurse should be aware, like how much temperature should be maintained in the operation theater, how much humidity should be maintained in operation theater, and how much Pascal pressure should be maintained. Like temperature should be 20 plus minus 3 it is, and
Yes.
it is different for the ortho surgery, like specialized surgery and
Yes,
normal
ma'am.
surgery. And there is a air change in every operation theater, like 20 to 25 air changes. In that there are 4 to 5 fresh air changes are
Yes.
there. And the humidity should be 40 to
40 to
60%,
60%.
and Pascal pressure should be 2.5 Pascal. So this is very important, I want to add in this. Thank you for the session. And moving forward to the next session, without wasting much time, I want to welcome Ms. Tripti Nayak. She is our the final speaker. The topic is ethics of surgical care, ethical consideration in perioperative nursing. So let me welcoming Tripti Nayak. Over to you, Ms. Tripti.
Good afternoon, everyone.
Lamber, can you please share the slide?
Good afternoon, everyone. I am Triptirani Nayak, Deputy Nursing Superintendent and Quality Nurse. Currently, I am in Ranchi, RCHRC, under Tata Cancer Care Foundation. Also, I am the Secretary of Chhattisgarh chapter of ANEI, and I extend my heartfelt thanks to Madam Dolly, Madam Sakuntala, Madam Mini Verghese, for giving me this opportunity to present the insight on ethical considerations in perioperative nursing care. So ethics forms the foundation of nursing practice in the perioperative environment where patients are vulnerable and often unable to advocate for themselves. Nurses play a critical role in protecting patient rights, ensuring safety, and upholding professional values. So through this presentation, we will explore the core ethical principles, common ethical dilemmas, and nurses' role as patient advocate in the surgical setting. So please go to the introduction slide. So perioperative nursing involves caring for the patient before, during, and after surgical procedures. Due to the vulnerable nature of surgical patients, perioperative nurses face numerous ethical responsibilities. So ethical practice ensures that patient rights, dignity, safety, and well-being are protected through the surgical journey. So ethical decision making in perioperative care is guided by professional nursing codes, legal requirements, institutional policies, and ethical principles. Next slide. So the ethical practice of perioperative nursing is based on 6 fundamental principles. Those are autonomy, beneficence, maleficence, justice, fidelity, and veracity. So autonomy is respecting the patient's right to make informed consent, Beneficence is acting in the patient's best interest. Non-maleficence is avoiding harm and preventing injury. Justice is providing fair and equitable care. Fidelity, maintaining trust and honoring patient commitments. Veracity, being truthful and transparent. So these principles serve as a guide whenever nurse encounters ethical challenges in clinical practice. So we will discuss about all these principles. Autonomy means respecting the patient's right to make decisions regarding their health care. So as perioperative nurses, we must ensure that informed consent has been obtained properly, patient understands the procedure, risk and benefits, and that their personal, culture and religious beliefs are respected. Patients also have the right to refuse treatment when even when the healthcare professional may disagree the decision. So we need to look after the we need to ensure informed consent is properly completed. We need to respect religious and personal refusals and support advance directives. Beneficence is doing good and promoting patient well-being. So this includes providing emotional support before surgery, maintaining clinical competence, ensuring patient comfort, and implementing evidence-based practices to achieve the best possible outcomes. So we need to act in the patient's best interest by delivering evidence-based care and promoting well-being, by provide emotional support before surgery, maintain professional competence, prioritize patient safety and comfort. Next slide, please. Non-maleficence.
ফোনে মেসেজ যাবে 15 দিন লিখতে হবে না ফোনে মেসেজ
Rupa, can you please mute the mic?
দেখুন তো এবার শোনা যায় কিনা মানে ফোন লাগিয়েছেন কি আওয়াজ হচ্ছে
ব্লুটুথেও তো নেই, ব্লুটুথে তো অন নেই, দেখো শোনা গেলে
আওয়াজ হচ্ছে আওয়াজ হচ্ছে
Can you please mute Miss Rupa? Tripti can continue.
Okay, ma'am. Non-maleficence means do not harm. So every action must minimize risk and prevent harm to the patient. In perioperative care, this involves strict adherence to infection prevention measures, accurate surgical counts, safe medication administration, and prevention of positioning injuries. Patient must remain our highest priority. So justice, it refers to fairness and equality in healthcare delivery. So every patient deserves equitable access and unbiased treatment. So if healthcare resources should be allocated fairly, and nurses should advocate for vulnerable and underdeserved patients whenever necessary. So I think sometimes we feel we come in a situation where we are unable to do justice. And I think most of us will agree. And how do we do that? Suppose we are having a VIP patient scheduled for the surgery, and meanwhile, a poor patient who needs immediate emergency surgery. So whom will you take for the surgery? We need to decide it like it should not be decided that the patient is VIP, but the patient safety should not be to be taken for granted. If the poor patient needs emergency surgery, so the patient should be given the first priority because it costs its life for the life, and the VIP patient can be like we can counsel the patient, or else we can make some alternative, and we should give justice to our patients. Fidelity, next. Fidelity and veracity. So Fidelity is about maintaining trust. It is not visible. Brother Leelambar?
That is the actual.
No. Shall I share the PPT? Shall I share the screen? Yeah.
Yeah, I'm sharing that.
Can you please exit from sharing? Is my screen visible?
Yes. Do the full screen.
Yeah. Okay, is it visible now?
Yes.
Okay. So fidelity means maintaining trust, honoring commitments made to patient, and upholding personal integrity all times. We need to keep promises made to patients, communicate honestly about delays or changes, uphold personal standards consistently. Veracity is truthful communication. Veracity requires transparency in all patient interactions, including disclosure of errors and adverse events. So report adverse event honestly, follow institutional disclosure policies, and document accurately and completely. Common ethical issues in perioperative care. So the common ethical issues in informed consent are incomplete patient understanding, language barriers, coercion by family members, consent obtained under stress or sedation. So our nursing role defines verify consent completion, ensure patient comprehension, and notify the surgeon if concern arises. Common ethical issues for surgical safety and error prevention are wrong site surgery, wrong patient procedures, retained surgical items, or medication errors. So, being a nurse, our role is to participate in surgical timeout, verify patient identity, conduct instrument and sponge counts, near misses, and adverse events to be reported. Common ethical issues in patient privacy and confidentiality are maintaining dignity during preparation and surgery, protecting confidential information, preventing unauthorized disclosure. So, being a nurse, we need to use draping appropriately, limit access to patient information, follow confidentiality regulations. And the common ethical issues we can find in during the end of life and high risk surgery decisions are futile surgical interventions, do not resuscitate orders in the operating room, balancing patient wishes with family expectations. So, being a nurse, we need to advocate for the patient preferences, facilitate communication among stakeholders, support ethical decision making process. So, ethical decision making framework in perioperative nursing. So, there are 6-step process guides perioperative nurses from problem identification through reflection, ensuring each decision is principled and defensible. So these 6 steps include identify the ethical issue, gathering relevant information, applying ethical principles, exploring available options, implementing the most appropriate action, evaluating the outcome. This systemic approach helps ensure decisions are objective, patient-centered, and ethically justified. It also promotes consistency and accountability in clinical practice. Being a nurse, as patient advocate, during anesthesia and surgery, patient cannot speak for themselves. So the perioperative nurse becomes their voice. So at that moment, the nurse becomes the voice. Our advocacy involves ensuring informed consent is valid, like protect rights, how we can protect right, ensure informed consent and advance directives are honored, how we can prevent harm. We need to speak up about the safety concerns and participate in timeouts. Safeguard dignity, we need to maintain privacy and respectful treatment throughout the care. Support ethical decisions, we need to facilitate and communicate among patients and family and the care team. So at the end, the key takeaways are ethical practice is not optional. It is the foundation of safe, high quality perioperative nursing care. The 6 ethical principles: autonomy, beneficence, non-maleficence, justice, fidelity, and veracity should guide every clinical decision. Perioperative nurse must consistently advocate for patient right, safety, dignity, and well-being. Using a structured ethical decision framework enables nurses to address ethical challenges effectively and confidently. Ultimately, our goal is to provide care that is not only clinically competent but also ethically sound and patient-centered. Thank you for your attention. So this ethics is not simply a set of rules. It is a commitment to doing what is right for our patients, especially when they are at their most vulnerable condition. So I hope this presentation has highlighted the critical role, ethical principles that plays a vital role in perioperative nursing practices. Thank you so much.
Thank you, Tripti. It was very, very, very excellent session. And you have highlighted all the points which is ignored. And every time there is a pre-operative nurses verify the patient identity and protect the confidentiality. Speak up about the patient safety concern or advocate a patient who cannot speak for themselves. Ethics is being put on in action. So ethical nursing is not just about knowing the principle, it is applying them every day to ensure safe, compassionate, and patient-centered surgical care. So with this, I would like to invite Mr. Mini R. Varghese ma'am.
So
to
before
deliver
Mini Shakuntala, just interrupting, before Mini, wind up the entire part, I just would like to take up these questions, which is for Vaibhav. There is a question that during the laparoscopic surgery, when the intra-abdominal carbon dioxide pressure goes above 15 mm of Hg and the patient EtCO2 is also 45 mm of Hg plus, what all you do first as a nurse? How will you maintain the end tidal volume for the patient? Question to Mr. Vaibhav. Vaibhav, will you be able to answer this? Mr. Vaibhav is here.
Vaibhav, yes.
Yeah, ma'am.
Yes.
I'm here. So, ma'am, standard safe IEP is 12 to 14 mmHg. You can request to your surgeon, we reduce the CO2 pressure, that is 10 to 12 mmHg. High pressure actually compress the diaphragm, reduce venous return, or increase CO2 absorption. Sometimes CO2 tubings or TOCAs also leaking, so excess gas something leak makes insufflator incompensate. That is also the reason. If we reduce the pressure 10 to 12, definitely will be good for the patient.
Thank you. I hope that everybody got his explanation rightly. Yeah, if you find such kind of thing, immediately you have to inform to the anesthetist so that the carbon dioxide level can be reduced. So
Yeah.
that is the primary part from the nursing side, which we can do or we can take up as a nursing responsibility. And Vaibhav has already explained, as he is a OT nurse, so he knows that where what interventions to be done. Thank you very much.
Thank
Any
you.
more questions from the audience? If anyone, because I mean the presenter have done their job excellently. Everybody have presented so well the ethical dilemmas and the ethical legal responsibilities which have been explained excellently. So if anyone still is having any doubt, we face every time the consents are not been done properly, the surgeon did not arrive or the registered medical officer also did not write the part, maybe surgery which is been planned, some additional plus will go on and which is not been written in the consent form, and then the signature is taken and then patient relative makes problem. So all those kind of issues that day to day's work life we are facing, and as a nurse we need to be very very vigilant enough while we are asking the consultant or the registered medical officer to fill up the consent, speak with the doctors, and then explain the patient relative. That is absolutely the surgeon and the surgeon team's job while we are taking the consent from a patient. Definitely, nurse will encourage, nurse will facilitate, but it is the responsibility of the doctor. So that we have to take in mind. Otherwise, presenter have done their job very well. Thank you very much. Now over to Mini.
Good afternoon, madam. This is actually Kavita Jagannath from Nimhans, Bangalore. All the presenter, as you said, presented very well, madam. This is very, very, very informative. And every day, day to day, we are facing the problem with all the things, patient party, patient, and then doctors, everybody will be depending on us only.
Yes,
And even
yes.
doctors will tell that I'm in a OT, I'm here, I'm there, I can't come, you do thing. And then we have to follow the protocol of our institute, like NAPH, Kayakalpa, all those things, we have to follow the protocol. Even just example, to sedate the patient without restraint form sign, we should not. But still, we are managing like anything. We are proud to be a tel nurse. And excellent team you are having, madam, presented very well. Congratulations to all of you, madam, from my side. Thanks a lot.
Thank you, ma'am. Thank you for your addition. Thank you for your appreciation too.
Thank you,
Thank
ma'am.
you.
Thank you, Dolly ma'am, for the constant encouragement and support every time. Even in the midnight, she is available to support us. Thank you so much, ma'am.
Yes, please proceed now because we have to now. Time is up almost.
Yes. Over to Miss
Good
Mini.
afternoon. Yes, good afternoon, everyone. On behalf of ANEI Chhattisgarh chapter, I am here for thanking everybody for the valuable presentation what they are given. I extended my heartfelt thanks to our speakers, Miss Brother Vaibha, Miss Elisha, and Tripti. Or they shared their valuable knowledge inside on preoperative nursing and patient safety. This is a good learning point for everyone to understand what are the things what we have to follow in the operation theater. My sincere appreciation and thanks to our Madhugarika madam and Dolly madam for the guidance and help you given to us or guide us for the presenting this. This is our chapter is a new. This is a first experience for us to share everything. Or this is your guidance only that we done this section. Thank you so much for your guidance and all. Thank you to the all participants, those who are actively involved and enthusiastically heard the presentation and learn, and they understand the things what we have to we learning every day, or we have to on the practical also we have to follow these all things in our day-to-day patient care. Or your contribution made, all participants are given their accurate participation for the activity, and they understand the sessions also. You're all this empower. The contribution made this empower our meaningful and learning session for everyone. Thank you so much for everyone for the attending this session. Thank you once more. Have a good day.
I think, Shakuntala, we have come to the end of the Empower Our AYNA Chhattisgarh chapter, and we will come back again with the next edition of Empower Hour. Until then, bye-bye to everybody, and thank you very much for joining. Thanks to all the speakers, delegates, those who have joined today, your contribution, and a big and great thank you to Shakuntala, who has actually taken all the efforts to join. Thank you, Shakuntala.
Thank you. I would like to thank Leelambar brother also, because in very short time he has coordinated everything. Thank you, brother.
Thank you. So I think we stop recording now, Leelambar.
Thank you, ma'am.
Yes. Okay. So we will log off. Thank
Yes,
you.
yes.
Have a good day. Thank you, Shakuntala.
Thank you all. Thank you,
Thank you,
Shakuntala,
ma'am.
ma'am.
Thank you, ma'am.
Thank you. Bye.